So with this talk, we want to understand the biomechanics of the Gillet test. So the Gillet test was designed to assess motion at one sacroiliac joint. So the way the test works is you have the person stand, and then they lift up one leg while standing on the other leg, and you test a sacroiliac motion on the side of the moving leg. So in this case, the flexing leg. So, but to understand the test itself, we first have to remember what the biomechanics of the SI joint are. So the axis of rotation for the SI joint is here, where this X is here. Okay, so the arc of motion occurs along this auricular surface, shown here on the lateral side of the sacrum. Okay, and what we can note is that if say this was the PSIS here, it's going to follow the arc of motion of the ilium. So basically, it's going to move inferior and down. So that's going to go in this direction. Okay, so as the person lifts their leg up, the ilium on the side of the moving leg is going to rotate this way along this pathway, and so this PSIS, which is here, is going to go inferior and downward. Okay. To track motion of the ilium on the sacrum, what we're hoping for is that the stabilized side, which in this case would be the right side, so that's the stance limb, the weight traveling through the body and then transferred to the ilium through the SI joint and into the leg will be stabilizing the stance side SI joint. So as the opposite leg comes up into flexion, what we're palpating for is we're putting one finger on the sacrum, we're putting another finger on the PSIS right here, and then we're going to track motion, and what we expect is that the PSIS will move anterior and inferior, just like we demonstrated here on this pathway that's rotating around the SI joint axis. Okay, so here's a demonstration of the motion on this plastic spine. So essentially we have a posterior tilt of the left ilium because the person's standing on the right leg. So I palpate the PSIS. I should have this slight motion relative to the sacrum when I have the person march or lift their leg up. So I'm expecting a posterior pelvic tilt on the side of the marching limb, and I expect stability of the sacrum on the side of the stance limb, so that basically gives us a measure of motion at the SI joint. So if the relative motion between my two thumbs is 0, well, that means that there's no motion at the SI joint of the marching side. If there's a slight drop in position of the thumb that's under the PSIS, that means there's a slight amount of motion on that side, and that's a negative test. Okay, so that's a normal amount of motion that's occurring. If there's no motion between my thumbs, that means that side's tight, and that's a positive test.